The liver is commonly referred to as the body's generator. The liver is conveniently located in the chest cavity just underneath the diaphragm. The liver is tasked with streamlining metabolism activities in the body through its ability to control blood sugar levels. The liver is also used in liver filtration in order to reduce toxic materials in the blood. From its functions, it is quite evident that a malfunction in the body can easily cause great fatalities, especially if not handled with the earliest possible medical attention. Liver cancer begins with the formation of a tumor in the blood. The formation of the liver tumor occurs after there is unregulated production of liver cells. The excess multiplication of the cells leads to the formation of cancerous cells that inflame the liver and hence the formation of the tumors. There are different liver cancer stages that affect the severity of the ailment to patients. Classification of liver cancer. Liver cancer is classified either as a primary or a secondary cancer. Primary liver cancer stages develop from tumors such as hemangiomas, nodular hyperplasia and hepatic adenomas tumors. Primary cancer can also result from other conditions such as kidney disorders and viral infections. In the latter case, liver cancer stages develop slowly as compared to the first stage whereby there are already formed tumors. These existing tumors easily enlarge and also affect adjacent glands by spreading from the tumors in the liver. Primary liver cancer stages are mainly evident in the younger generation kids as opposed to the older people. Secondary liver cancer. This type of cancer occurs momentarily when the spread of the cells within the cancer cells start spreading all over the body. This liver cancer type is medically known as a metastatic cancer. In most cases, primary liver cancer stages cause a secondary liver cancer. Other known possible causes of liver cancer include colorectal cancer, which is an advanced stage of other types of cancers such as lung and breast cancers. The transmission of cancerous cells from one body part to the other takes place through blood circulation all over the body. Liver cancer stages are greatly worsened by the spread of the cancerous cells from one body part to the other. Signs and symptoms of liver cancer. Symptoms of liver cancer differed from one liver cancer stage to the other. In the initial stages, the symptoms are usually mild and do not cause any far-reaching health effects on the patients. In the first liver cancer stage, the symptoms of the disease are usually not very evident. It is therefore quite hard to be able to positively identify the presence of the illness in the livers. However, with the use of high technology and advanced equipment, establishing the existence of the disease in this stage is easy. In the advanced liver cancer stages, the signs and symptoms are clearly noticed. Liver cancer signs and symptoms include pain around the liver. Liver cancer patients experience acute pains in and around their livers. This is usually as a result of liver inflammation that occurs due to the effect of the presence of cancerous cells in the liver. In addition to the inflammation, the first and second liver cancer stages are characterized by a painful swelling in the liver. This inflammation is not specifically cancerous, but there are usually very high chances of it turning cancerous with time. Unusual change in the liver size. In the third and fourth liver cancer stages, there is usually a change that occurs in the liver size. The change in the liver size is characterized by bleeding in the liver. There is also a high possibility that the liver cancer patient is bound to experience continued abdominal pains. It is important to seek medical help as soon as you identify any of these conditions in your body. This is due to the fact that your cancer attack can possibly be in the initial liver cancer stage and hence can be easily treated. Stages in liver cancer. Liver cancer stages differed from each other with respect to the level of severity in each stage. In the early stages of the disease, the effects of the disease are not as developed as they are in the last stages. Stage 1. In this liver cancer stage, there is only one tumor that exists on the liver. the cancerous cells are usually confined within the liver, and as such there is no spread of the cancerous cells to other glands and organs. More so, in this stage the disease may not be positively identified and may commonly be mistaken as liver cirrhosis. Stage 2. In the second liver cancer stage, there are usually great developments that are witnessed. The first sign is that there is usually an increase in the size of the tumor in the liver. In addition to this, the cancers are usually spread to other adjacent glands in this stage. It is also possible to identify different tumors that may be existing in the tumor. However, none of the tumors is usually more than 5 cm large. The effects of the disease in this stage are felt by the patient. Stage 3A. The third liver cancer stage is usually divided into 3 parts. In the first part, there are several tumors, with at least one of the tumors being fairly larger than 5 cm. There is a possibility of having a tumor that is spread all over to other body parts such as the hepatic vein.
Stage 3B. In this second phase of liver cancer or stage 3, the cancerous tumor in the body usually spreads all over the adjacent glands excluding the gallbladder. The main area that is affected by the spread of the cancerous cells is the abdominal lining. Mostly patients feel acute and sharp pains on their abdominal lining.
Stage 3C. The third phase of liver cancer stage 3 is quite similar to the last stage of the liver cancer. In this stage, the cancerous tumors are usually very developed and very painful. In some cases, there is a high possibility of experiencing bleeding in the liver. In this stage, the lymph nodes are usually greatly affected by the cancerous cells. Stage 4. This is the terminal point of liver cancer. The fourth stage is characterized by severe symptoms that easily lead to death. This is the full-blown stage of liver cancer, whereby there is usually a very high possibility of treatment options being unable to cure the cancer. In conclusion, liver cancer stages differed from each other, and it is therefore very important to keep track of the progress of your liver cancer ailment. This helps a lot in choosing the best treatment option to apply.